So we're going to shift focus now a little bit, and I'm going to invite Andrew Moseley to come up as our next speaker. He's the Head of Government Relations and Policy at the Leukemia Foundation. He's worked in advocacy across a number of Victorian and Australian governments, not-for-profits. He's part of the NHMRC's Consumer and Community Advisory Group and the Consumer Health Forum's Digital Health Specialist Group. So please give Andrew a big warm welcome. You've just got to hold your clicker up like that.
Sure. Thanks, Sophie, and thanks for sharing that incredibly powerful and poignant story. It really makes us all self-reflect and think about our own stories, I think. Thanks for that introduction, Sophie. And the first thing I'm going to say is that this morning when I was coming in, I was herded up as part of one of the school groups and mistaken as a apparently 16-year-old. So I would like to point out that I'm 42, I don't look it, but hopefully I've got a little bit more experience and can draw on a little bit of that as we go through this presentation. That's been my number one learning so far, that I need to grow some stubble or something. So, so thank you again. I'm really pleased to be here today and representing the Leukemia Foundation and to be able to have that opportunity to talk about the experiences of the patients that we look after and that we have those ongoing interactions with. We obviously provide support services for blood cancer patients and also fund research. One of the other really important things that we do is try and contribute to that evidence-based policy approach and come up with evidence-based policy recommendations. One of the main things that we've done, I guess over a couple of years, is a couple of key policy documents. So one of those was working with the Blood Cancer Task Force nationally to develop and help develop, I should say, the National Strategic Action Plan for Blood Cancers. We also do a periodic State of the Nation report. This is something that we do every couple of years. The first one was 2019. The most recent one was this year, and we launched that in February. The first substantive point I'd like to make, apart from the fact that I will be drawing on these documents as we go through, but genomics as standard of care was one of the key themes that has come through all of these reports. So this slide is not supposed to depress, it's supposed to make the point that blood cancer is a problem. It really underscores, I think, the scale of the challenge, and the reality is that blood cancers do affect so many different people and touch so many different lives. The sad fact is that blood cancers are high mortality, they're non-preventable, and they're expensive for patients, but also they're really expensive for our health systems to treat. They're also difficult to screen for, difficult to diagnose, and difficult to treat. What this means in practice is that the journey through which patients go through can be a really challenging one. They often have to go through multiple treatments and often with a high degree of uncertainty. And I think in previous speakers today, we've heard a little bit about what some of those decision points and sliding doors have kind of looked like. A really important point to reinforce here, I think, is that when we talk about blood cancers, we're talking about over 120 different subtypes of blood cancers. Many of those are rare, some are less common. Each requires bespoke treatment and care. So their uniqueness is important for how we treat them. Hence precision medicine and hence the real need for genomics. So genomics helps us be more precise, and shock horror, that's a really good thing. It's particularly important for blood cancers. It helps with accuracy, it helps us make the right choice sooner, and it helps make, hopefully, it helps us get to that right choice sooner rather than later, which can be really important, particularly for acute and highly aggressive blood cancers. Again, I think it's important to reflect on what that means for patients, because it means that we can circumvent some of the real challenges that people experience as they go through what can be a really long, a really painful journey. It's also what patients want and what patients need. So in the most recent version of the State of the Nation report that I mentioned earlier, So we did talk to survey results from over 4,600 people living with blood cancer, as well as additional one-to-one interviews with other sector stakeholders. Those patients told us that one of the most important things to them, based on their experiences over the life of their journey, was to have better diagnostics, because that was the part that they really, really struggled with. It's also important to acknowledge that this is not just patients. There are plenty of experts that are talking about how important genomics is for healthcare. We've had the Medical Services Advisory Committee, so the group who, I guess in short, makes recommendations for subsidy. They have recently, so March this year, they made a couple of recommendations for particular types of genomic testing. We've had the World Health Organization, the Novel Therapies Parliamentary Inquiry, and various other reports, and I'd add to that the Chief Scientist recently spoke about the importance of genomics for us going forward, the Department of Industry and Science, and building in that sort of cross-departmental and cross-portfolio approach. They've also talked about the real importance for genomics, and with their consultation last year, they nominated that as one of our key sort of scientific and research priorities. One thing I think it's really important to highlight here is not just what they've said, but it's the rationale that they have used to come to these conclusions. Particularly the Medical Services Advisory Committee talked about genomics not simply being part of a health system, not simply being part of what we're trying to do, but as being central and a normal part of that. And I think it's a really important distinction to make. So we know it has real-world impact. In that the State of the Nation report, we asked patients obviously about their experiences. 31% of blood cancer patients who had a genomic test reported back to us that that genomic test changed their treatment and also in some cases changed their diagnosis. We know that other research has come to similar sort of conclusions as well. And one patient was talking to us last week and said the key benefit that this person had was really around being able to take a risk-based approach. So knowing more, and by knowing more, you're able to make better decisions, including when to take on some of those more particularly challenging type of treatments and some of the chemotherapies as well. So this is something I get very excited about. This is the blood cancer genomics trial, and this builds on what David was talking about earlier. It uses some of those same methodologies. I get excited by this. I'm not allowed anywhere near it because I get very excited by it. But essentially, the researchers in this trial are trying to match treatments to people's individual blood cancers. I think that's exciting. I think this move towards that targeted, personalised approach is a really exciting thing for everyone. And I think that's the real strength. And when people come to these things and they hear it, and I think we know it, and I think one of the opportunities perhaps that we have is to be able to tell the people upstairs that this really can change people's lives. So what then are some of the barriers? Some of these were covered earlier and in great detail and very eloquently by Jane and Tiffany. But one thing I'm going to highlight here is that many diagnostics have regulatory approval, but they're not subsidised. A key challenge there is that people that might be more well off are able to access some of the things and other people can't. My family is farmers, and we've had neighbours who've had that problem. They're not able to travel, they're not able to leave their source of income. Even if it's a couple of $100s, that's a lot of money to them. And that's something that I'm very passionate about and thinking about, well, how is it even more challenging for people in rural and regional areas to access some of these as well, particularly when there's that financial component to it. On top of that, we know that some genomic diagnostics are available overseas but are not available here, and I can tell you that one of them, and as obviously clinicians in this room as well, one of the most challenging conversations that I think you can have in a patient support organisation is talking to patients who have been told there's nothing we can do for you, but they know that there is. They've looked overseas, they've talked to people. We've had a really great example of someone who went to a conference overseas, someone told her about a trial they were doing in the US. It's a really, really challenging conversation, and it's not fair. And that's something I get quite passionate about. Excuse me. That trial the trial I mentioned before is well underway, and we are trying to help generate evidence to help support some of these moves for change and to think about how we can try and overcome some of these barriers. One thing I'd add to this is that we know that the uptake is not as high as it should be. We know that the uptake of genomics is inequitable. In that, the research that we've done, we asked patients about their experiences, and they said that only 1 in 5 knew whether or not there was a genomic test involved in their diagnosis, and we really want to see that increased. So State of the Nation underscored the need for change. The research has showed that many in the sector agree with that. This is just a quick sort of snapshot of, I guess, a sample of the feedback we've received. It demonstrates, I think, an appetite for genomics, and it also highlights that people know that this can have an impact and that there is that appetite for change on the ground. So where do we want to get to? And this is the exciting part. What we want is genomics as standard of care. This is where we think we can make the biggest impact for patients. We know that Australia needs to improve access to genomic testing for blood cancers. We're really trying to hammer home this message that by making it a standard of care, we can really improve outcomes. And if we do that in a right way and everyone can access it, we can also help address inequities as well. So there are several things that we think can be done. So obviously increasing, in some cases starting public subsidy for genomic testing is one of those, and that we think there's a real equity issue there. The next couple on that slide there talk to skills, and this also was mentioned earlier, and I won't dwell on it, but we do think that there needs to be money, time and effort into investing in the labs, investing in people, and also promoting initiatives that will help and encourage people to continue the research into this field. Finally, and I will end on this, I want to acknowledge that there is a lot of work underway. We've heard about the Rare Cancers Parliamentary Inquiry, and I agree that that's a really exciting opportunity. I think I get excited by these things. I do think it's an exciting opportunity because there is so much work being put into this, there is so much focus on it, and I think that is something to harness. We've heard about the Australian Cancer Plan, and we look forward to it being released, as I know many other people do as well. And I think these are opportunities for patients to be able to stand up and have their voices counted, both in terms of the development of some of these, but also in terms of how they're implemented. So we don't just want a policy that gets announced and then starts being implemented, I should say. We want to be part of how it's implemented, because that is often how you reach different groups, and you're not just reaching the one group right across the country. I'll leave it there. Thank you very much.